malodor or bad breath coming from the mouth is medically known as halitosis. This can occur due to a variety of reasons. The simplest of that is people not brushing their teeth properly and adequately. Now, apart from that, smoking, liver disorders, diabetes, constipation, any respiratory tract infection, sinus infection, growth in the sinus, in the nose, etc. can produce this. Certain types of alcoholic drinks also can cause this. Obviously, when there is a bad breath coming out of a man's mouth, which woman would like to kiss him, especially French kissing, mouth to mouth kissing? That is understandable, reluctance. So every man and woman should take care first of their oral hygiene. They must brush their teeth properly, adequately, and also they must also clean their tongue. The reason is simple. If they don't brush their teeth properly, bacteria will get collected in the gums, in the teeth, and on the tongue. These bacteria will release sulfur dioxide, which will smell bad. So, proper brushing, possible twice a day, morning and after dinner. Dental flossing, cleaning the tongue, etc. is important. The second most important reason will be smoking. If any of you have smelt the breath of a smoker, it will smell like a gutter. So smoking will definitely cause problems. Any liver disorder which will produce indigestion, that can also produce bad smell due to putrefaction and decomposition of the food particles inside the mouth, inside the stomach. Diabetes, if not properly controlled, can also produce bad breath. Dehydration, not taking adequate fluids, that also will produce problems. Bad breath. Again, any sinus infection or upper respiratory tract infection like the throat, the bronchus, etc., windpipe, that if the infection is there, they can also emit a bad breath or odor. Again, a small tumors, bumps in the nostrils, sinus can produce or emit bad odors. As I mentioned, certain alcoholic drinks can also create a problem by their decomposition. How is one going to overcome this problem? First and foremost, proper adequate brushing of the teeth, cleaning the tongue, dental flossing, known as attention to oral hygiene. If possible, at least once in 6 months, get a dental examination done by a dentist. Quit smoking. Again, make sure digestion is proper. If you have a problem, check with a doctor and make sure your digestion is proper. Keep diabetes under control. Make sure you have a regular bowel movements and you pass stools on regular basis. Again, refrain from drinking too many coffees because caffeine also will affect the odor. That's very important. Again, after each meal, rinse your mouth and spit out the water. That will clean your oral cavity. And whenever you have a doubt, please check with your doctor. And most important, before indulging in a sexual act, especially French kissing, the couple should use their mouthwash to rinse their mouth, or suck or chew on a clove, which will prevent bad odor from coming out. Or they can take a mouth freshener. When they do this, the smell will be good. It will not put off the partner from kissing the person.